Welcome to Dental All Stars. I'm Alex Nottingham, founder and CEO of All Star Dental Academy. And with me is Heather Nottingham, co founder and VP of training. And we are talking about sales redefined. Please welcome Heather.
Hi, everybody. Hi, Alex. Thanks for having me today.
We are happy to have you.
Yeah.
Sales redefined. Over the last few months, you were playing with this model. You love acronyms. And we at All Star Dental Academy believe in service. We don't believe in sales in the sense that the way it's been defined, right? As we're redefining it
Mm.
in dentistry and just abroad, sales has a negative connotation. So we prefer the word service. Now, yes, you need sales for revenue. Yes, there's a process of selling, but it's a used cars manipulation we want to avoid with respect to that's what we choose service. But there is a way of redefining, and you were working on this acronym. So tell me about, or actually maybe before we get
Yeah.
to sales redefined, because then there it is and the podcast is over. Before
The
we get,
end.
let's do the drum roll. And do I have a drum roll here somewhere? I think I have a drum roll. Do I? On my Nope, I don't have a
No.
drum roll. Oh, whatever. I have an air horn.
The r-
I don't even know. Oh, here it is.
I
Yeah,
guess
yeah.
you
It's
do
not
it
working
like
on my.
it's like Christmas
I
vacation.
know we should have that. We should get that
It's
working.
okay.
Anyways, my sound effects are not working at the moment. But we're talking about, let's go back to the history. Why service over sales? Maybe a little bit of history about, for those who haven't heard a story about All Star, where you came from in that perspective. So tell me.
Yeah. Well, just going back to when we worked for your dad's practice, my father-in-law, there was a lot of training out there and we were exposed to different companies and different things. And one of the things that we saw that just really wasn't the right fit for our practice in particular, and I know it's not the right fit for a lot of practices that we talk with, is just a very heavy sales based approach where it's very much about closing and get them in and get them booked. And we don't want to spend a lot of time focusing on the patient's needs. We just want to get the appointment booked. And then when we get them here, we'll wow them with our treatment. And for us, that just, I don't know, for me at least, it didn't feel like the right way to do things coming from the background in retail sales and management. And just when you're dealing with, I mean, dentists are dealing with patients that, potentially spending a lot of money. It was the same thing with our retail store. And I know with luxury hotels and things like that, most of the first impression makes the difference. And so everything is sales, as you pointed out, yes. And it's really mostly about relationships, forging a relationship with the person that you're talking to on the other end so that there's innate trust and respect and they like you and they want to do business with you. And I feel like if you do that and you have that rapport and that relationship, you don't really need to sell. Like, and when we say sell, we're talking about like pushy, manipulative, salesy, where the person feels like icky about it. I feel like when you're doing sales the right way, or what we call ethical based selling, there's a win for both people. There should be a win for the practice. Like, look, we're gaining this really great patient that I feel like we can help them. And then there's also a win for the patient that we're providing them a service and improving their life and making them better. And the goal of the sale or the connection, the relationship is not just to get them in for that one appointment. The goal is we really want to create a lifetime relationship. Dental practices are open for a long time, and some dentists that we work with are third generation where, they see people and then their kids and their kids' kids. So if you set up the relationship properly with that person, then they're going to keep coming back, and that's the goal, and that's how we're make money without having to like make it about the money. We make it about the person and about the care and about the service, and from that the money is going to come. But that's when I'm talking about redefining sales. Is yes, everything is sales. I mean, our son trying to convince us he doesn't have to do his homework and he should watch TV or be on his phone, that's a sale. And us falling for it, that's also a sale, or not
Right,
falling for it.
right.
So, yeah, so that was kind of the premise, is seeing what was out there and what we didn't like in dentistry. And it's also team members, quite often, they don't appreciate having to be like manipulative salespeople either. They don't want to deceive patients or feel like they're doing something unethical. They want to provide good quality care and treatment. And so when team members are asked to take that approach, the very closing, like, these different words that companies use, there's typically a pushback. And, then we wonder why they don't want to do it. Now, if they're closed off to any sort of training, that's not good either. But if you're being taught relationship based, ethical based, techniques of verbiage, communication, rapport, that's the type of sales that any team member should be on board with, not get them in.
Yeah, and like you mentioned, the words you want to look out for is closing. Let's close them. Let's get
And
them in. I mean, we have in our webinar, allstardentalacademy.com/webinar, our flagship, flappy flappy, our flagship webinar
Mhm.
that we update every year pretty much. And if you haven't seen it for a while, take a look again, allstardentalacademy.com/webinar. And we talk about the sales pyramid, which is mostly, it's very little rapport. It's
Mm.
mostly sales and
Right.
closing. And then the
Mhm.
VIP, or very important patient pyramid, we look
Mhm.
at mostly rapport, which is the ability to build trust and respect with somebody else. And then we get to know their needs. And then you become the logical choice. You don't have to
Mhm.
sell.
Right.
So that's where we're trying to transition, and with respect to that word. So always be careful where the word is coming from, how it's being phrased with respect to that. And that's really where we try to make a difference in the industry. And that was where we started
And I
about
think
service for sales.
dentists too, it's not just the team, like, because I'll hear, oh, my team, we did this training or this other program, and they were basically telling team members to lie about if you take their insurance or things like that. Like, if they call and they ask, do you take this insurance? You say, oh, sure, come on in. And I've even heard really, popular trainers that'll say, and I'll ask them, what do you do if they come on in and they don't have that insurance? And they're like, oh, we just either they get upset or we write it off. And I'm like, why don't you just start the relationship off with integrity, ethically, building rapport, connection? Like, if you do those things and you have a great practice, you shouldn't have to trick somebody into coming in. And so naturally, team doesn't like that, the manipulation. But believe it or not, dentists don't like it either, because they don't want to have a bad reputation. You don't want to have a bad reputation for your practice. And so a lot of dentists that come to us that work with us, they say, I really appreciate your approach, that you're just setting things up. You're teaching my team to set things up properly with patients so that we know that they're having a good relationship, that we're going to get great reviews. We're going to have these people come in and with trust already built, with a rapport already built, so that when you do go to present treatment, they're excited and ready to accept it. So all of this on the front end makes case presentation and case acceptance so much easier. So it's a great process.
So Heather, tell me,
Yes.
sales redefined. What is it? What does it stand for? How do we implement it?
Well, it's just something silly that when I was thinking about it the other day, and as you mentioned, Alex, I like to think in acronyms. We have our great call process at All Star, which is our 5-part process of answering the phone call with GREANT. You can watch other presentations and podcasts to learn more what that means, and the Dental Practice Excellence webinar. But essentially, when I was thinking about the word sales, SALES, it's the first S I coined as service. Then the A is appreciation. The L is listening. The E is empathy. And then the final S is support. So those are all the things that it's kind of like the recipe for having a good sales process, is you have all of those things. Because quite often when we listen to calls from team members, or we talk to people, our coaches work with team members on their interactions, practicing for the phones, sometimes just basic things like empathy are missing, right? Like, I don't know if it's more common nowadays or if it's not something that's being taught, but people don't innately, like if somebody calls up and they say, I broke my tooth, I'm in a lot of pain. My mom, she just cracked a tooth the other day, and she said she called up and it wasn't like, oh my gosh, that's so terrible. We can help you. Don't worry. We're going to take care of you. You're a fear patient. They're just like, okay, when did you want to schedule? Like all of those opportunities to make the person feel heard and special and important, that all goes into the sales process. And that's why I feel like I was successful in retail, or, people that are successful whatever role that they have in various companies. There's the element of relationship, of listening, of empathy, all of that. So, we can definitely elaborate on the various aspects if you want, or we can just kind of leave it as those are the words that we've outlined.
Those are the words. Mic drop. That's it. No, let's look at each word.
Right.
And I think what I like to do is maybe you could even, we have a lot of members that listen, and we put much of our content online, pieces of it. So maybe we can go to each one and maybe reference some of the things that you teach, ways to apply it. Maybe you can even connect it to the recall process, like how it relates. So we're gonna go through each one. So first,
service.
So service.
Right. So service.
And we just talked about it. I talked about, started with service, that theoretically that we're using the VIP, which I talk about that in the webinar, the very important patient pyramid, that we're focusing mostly on rapport, and you become the logical choice. So service is rapport. So kind of, I guess, maybe build on that.
And if you take service and you think about the best companies that provide the best service, whatever the industry, like for hotels, I think of the Ritz-Carlton, or, in fast food, you think of Chick-fil-A over like McDonald's or Burger King. And you think of these great companies that have really, really high levels of customer service that are constantly being studied. The defining factor and why they're so successful is they do training. They intentionally practice. They know their vision, their values, their mission. They talk about what service means to them and how we do things. So like at Bloomingdale's, for example, we didn't just hand somebody the bag. We didn't just put the bag of merchandise. Like if you go to a store, they bag it up. Here's your stuff. Some places you're lucky if you get a bag, or you have to pay for a bag now. Self-checkout. But at Bloomingdale's, they not only wrap it and put it in a nice brown, the big brown paper bag, they actually walk it around the counter and hand it to the person in their hand. If you go to the Ritz-Carlton and you ask where the restroom is or where to find something, they don't just point and say, oh, it's down there to the right. They'll say, I'll walk you there. And they actually walk you there, and they open the door for you and show you to the restroom or to wherever you're going. They go above and beyond. They exceed expectations. So when it comes to service, it's the same thing. Over the phone, in the office, whatever it is. If we're presenting treatment, we just go the extra mile, right? No matter what it is. If it's the phone call, for our patients that used to travel to us for dentistry, I would print out all the different hotels in the area. I would offer to call and book them reservations. I mean, some dental offices arrange a car. It depends. And that's up to your practice to talk about what is your standards and what is your level of service that you're willing to provide.
And I think as a exercise, those that are listening, you can use this with your team. And as we go through each of these letters and these words, ask yourself, how are you providing service for your practice? And where can we, and this could be something you can review every week, to say, can we be mindful of this? Demure.
Right? Very cutesy.
Very mindful. So S, what's the next one?
And just one last thing about service is, in the All-Star online training program, we have an entire course called Customer Service 101 that's dedicated towards going over the service aspects of the first phone call up through the patient experience. What are we wearing? How does the office look? How does it smell? What are we saying and doing with patients to provide that extra level of service? So if you're a member, you can check that out. If you're not, sign up for
That's
the
a good course to remember and make sure we
Yes.
get to. There's so many good courses at
Yes.
All-Star, the
I
system.
love that course. It was supposed to be an hour and I had so much,
You
it
had so
was
much fun
2
with it.
hours.
There's a lot of information.
So the next letter, the A in sales, is appreciation. So really just letting the person know, whether they're in person or over the phone, that you appreciate the fact that they took the time to reach out, to get in contact with you, to research. When people call a business or they go to an office, they've taken time out of their day. They've taken time, money, they've spent money, time, effort to get there. They've done research typically, they've read reviews, not all, but a lot. They've looked at your social media. So, really just showing that appreciation that you're grateful that they've reached out and that you're there to help them. If they're a current patient, continuing to show appreciation for the fact that we appreciate you, our patient in the office. We're really grateful to have you, and remind them of that often. Whenever you see them, they're overdue for an appointment. We appreciate you as a patient. We're looking forward to seeing you. So I think, and even, you can do like we did in your dad's practice, we did a patient appreciation party and things like that often, where we would acknowledge patients and invite them into the office and have appetizers and, have little fun swag bags. So there's all sorts of different things. I know that our son's dental office, the pediatric dental practice, they're always doing like, where they do a party and they have like the food trucks that come and the balloons and the magician and everything. So any type of appreciation goes a long way. The sales process, thanking them for meeting with you, sending them a letter, sending them a follow-up, whatever you can. So that's the A.
All right. And make sure you're asking your team, how do we appreciate? I'm making up these words today. How do we appreciate patients?
Yeah. So next we have the L in sales, which is listening. So listening,
What'd you say?
What?
I had to do it.
That it goes without saying, but we do talk about it often in the online program. We talk about the fact of not just listening, but practicing active listening, right? So active listening is where we're listening to the person, we're nodding, we're acknowledging, we're hearing them, and then we're reflecting back what we've heard them say. Let me make sure I understand you correctly. Here's what you told me. Here's my understanding. Asking them more questions, being involved and engaged in the conversation. So, let me make sure I understood you correctly. You initially called because you had Y and Z concerns about your smile, or you had this concern about pain in your upper right hand, upper right tooth. So, tell me more about that. Tell me, how long has this been going on for? Issues have you noticed? And just asking them questions and staying active in the conversation. And if they have an objection, let's say, well, I really want to do this treatment, but it's too expensive. Okay, I hear you saying that it's too expensive. Tell me more about that. Like, have you gotten this evaluated by anybody else previously? Or is this something that you are setting aside money for? Whatever it is. So just really active listening and listening so that they feel like you're hearing them, I think is the most important part, and acknowledging what they're saying.
Continue.
So next would be empathy, the E. So empathy is where we're understanding where they're coming from, right? And I always get confused the difference between sympathy and empathy, right?
Well, sympathy is, hey, I feel bad for you.
Mm.
Where empathy is like you're there with them.
You're there with them, right? Okay. You're like, I'm here with you. Like, let's see what we can do to fix this and make it better. So
like sympathy is somebody's in the hole and you just say, I feel
you're
bad,
like,
you're in the hole.
right, like they're down in the hole and you're up. You're
Oh,
up
sorry about that. That doesn't look like
oh,
fun.
that stinks.
And empathy is you go down and sit there with them in the hole.
Exactly. Yeah. You climb down there, you're there with them, and you're like, listen, I get it. I've been there. Like when dentists tell me they're stressed, they're frustrated, they're having all these work-life balance issues or, things with their team that are going on. I'm like, listen, I understand and I get it. I've been there. We run a business here too. Like, we've run a dental practice before. So I completely understand. And let's figure out how we can get this resolved together. And let's talk about solutions. So listening, being part of the solution, offering suggestions, seeing also helping them try and figure out how maybe they can come up with some things as well. So I think just listening in this day and age, a lot of times it's like everybody's busy. We're not really listening with the intention. We're listening to respond to the person, but we're not really listening to see how we can best help them. So I think listening, empathy, all of those kind of are very similar. So we did empathy. Now we have support. So support is the final step, and just making them feel supported, making them feel like we're there for them. I tell team members all the time that on the phones or in the office, the biggest thing that we can do with patients is make them feel important. And that's why I think that it doesn't matter when you're talking about sales, it could be sales in dentistry, sales in retail, any area, any industry. When the person feels supported in their decisions and they feel like I'm trying to think of the words here. They feel like they're supported and we're supportive of them, they're more easily going to move forward with the decision versus like if they're not, if they feel like they're on their own. I always say that every single person is walking around with a sign over their head that's basically like, make me feel important, right? And so if we can offer that support to them and that feeling of importance and we're helping them, they're going to more so work with your office versus another office where they're just like if you're going the extra mile for them and another office isn't willing to do that, or they're just like, well, I don't understand this insurance stuff, or that's not my job, that's not my problem. Like, even calling somebody back when an office like says they're going to call you back, or they take the time to do what they say they're going to sooner than when they say they're going to do, that's an office that most people are going to want to do business with. Versus if you say, oh yeah, we're too busy, or you'll have to just text us or whatever, it doesn't typically work and the person's not going to move forward with whatever it is. So that's kind of, just a silly little.
Never silly. You're such a good teacher. The sales redefined. Certainly use the sales acronym to redefine sales, to kind of spark your team. We talked about the resource allstardentalacademy.com/webinar for the Dental Practice Excellence webinar, where I talk about phone skills, some of the great call process and others in there, as well as broken appointments, how to reduce turnover. Heather, tell me a little bit before we kind of adjourn. Mm-hmm. You're the VP of training. Yes. You did the phone skills course, which is the cornerstone course on the program, as well as customer service. And we do case acceptance, patient experience, everything that you need for team training and doctor training. Tell me about the program. I hear you talk to a lot of dentists. Like, might as well ask you while I have you on here, maybe a shameless plug here, but why be a member at All-Star? Why? And I guess the pinnacle of the All-Star membership is the online training program. Like, why should a team do it? We're talking about sales versus service. Just tell me a little bit about it. You're so passionate about the program.
I think it's just going back to what we talked about before, where the businesses and the offices that do training typically are the most successful. I always tell doctors that we don't have a lot of offices that are bad offices. Our offices that we work with are really, really good offices that are just always looking to get better, right? Like, you see the best athletes, the best musicians, the best artists, whatever their talent is, they're constantly practicing and seeing how they can improve. So the online program is not like, it's great if you have a new team member. It's great if you have an existing team member that needs some extra refinement. It doesn't mean that they're a bad team member. It's just like, I'm always working on myself and being coached and learning and improving, just the same as the best people in any industry are. Dentists, I know that you all often do a lot of CE and continuing education, and you're not doing that because you're a bad dentist, right? Like you're doing it because you're a good dentist or great dentist, and you always want to keep improving your clinical skills. So just the same as that, we're always looking to upgrade and improve our practice management skills with the best customer service that we can. The more we can learn, the more we can improve our verbiage, the better. So sometimes offices will say to me that they sign up for the online program because they have some new team members and they want everybody to be cohesive and on the same page and, talk the same, sound the same.
Some of doctors too. They also go through the program.
They'll say, we have some new people here and some really seasoned people here, but we're inconsistent when it comes to our verbiage, our communication, our practice management. Maybe they've never done training before and they don't know time management, pre-blocking of the schedule. They don't know how to, have a cohesive customer service process in the office or verbiage. And one of the biggest challenges that offices face is converting new patient phone calls to appointments and actually getting them to show up. That's the biggest thing that a lot of our offices do.
Call, convert, show up, and then
accept treatment.
Refer. So we always say,
right.
Call, show up, accept treatment, and refer. I will say, so I mentioned the webinar in the program. I would say take a listen to that, watch it. And then I'm going to offer you, Heather, if you'd be willing, if you watch the webinar and you like what you have to see, reach out to us. Heather will make herself available. She's a co-founder. You're going to meet with her. She built the thing. She wrote the bill.
Right.
She's a VP of training. She's the main, we have multiple instructors, but I think the cornerstone is phone skills. And so what's nice is she will do sales on you. She will do sales redefined on you. She will go through the sales that we talked about today, the service base, right? Appreciation, listening, empathy, and support, and really get to know you. And I'll tell you what's really interesting. The external problems, we certainly address that with you, with All-Star. Phone skills, open time, broken appointments, case acceptance, the patient experience. But I'll tell you, that's just the surface. It's the internal problem. That's what we get to know you. That's the rapport and empathy. Where we see that it's the confidence to lead your team. It's your team cohesiveness that you want, the stagnation that you want to avoid. That's the internal struggle. So that's why we love to speak to you and get to know you. You're not just a number, not just an online program or a DVD or seminar that you go do and you never touch it again. Our goal at All-Star is to serve you from the external, the internal issue, and even the philosophical issue that you deserve better. That's what it's all about here at All-Star.
Yeah. And we really, like you were saying, we talk to every new client. That's really important to us. It's very much like a family that likes each other here, all of our interactions, we're always there for our dentists and teams. They feel they can always contact us if they have questions. It's just good old-fashioned, it's not old, but it's old-fashioned quality customer service training that, we're really teaching the customer service, phone skills, scheduling in a way that is very recipe book. So it's easy for team members
very easy to implement.
20 minutes a week. It's very easy to absorb and implement. We have all the role play examples in there of the most common challenges. There's a full resource library. We do a call grade each month with an actual call.
Oh, you give them the webinar. They have to watch the webinar.
Sorry.
No, watch the webinar. Here's the point. Watch the webinar, get all the details,
yes,
and then talk to Heather. And a lot of you members are listening as well. Hey, we'll talk to you as well again. We love talking to you.
Yes.
Come to our event, All-Star Live. Heather, thank you so much for being on the program.
My pleasure.
And remember to follow us on Apple Podcasts, Spotify, YouTube. Get all the episodes. Share with your friends. And until next time, go out there and be an All-Star.